Our next talk is from a person we'll claim as New South Wales Welsh, but you'll hear very quickly that Dr. Diane Watson, who is the CEO of the Bureau of Health Information and the acting CEO of the National Health Performance Authority, actually comes from places further afield than New South Wales. So, Di, tell us how the performance framework's going to work.
So thank you very much for the opportunity to spend some time with you today to tell you a little bit about this newest organization on the Australian health scene, the National Health Performance Authority. It was going back, I would say, until late last year. I had the tremendous honor of being nominated by our Minister and Director General to sit on the board of the National Performance Authority, of which I told her at the time, and we'll take the opportunity to tell her again, is personally just so satisfying, being in this career of monitoring and publicly reporting on performance, to be nominated to be on the inaugural board. Shortly after that, however, I submitted a notice to take leave from the board and being asked to serve as the acting chief executive to help set up the organization while they began the recruitment process for staff and for a chief executive. So in the presentation today, I want to move away from the sphere of activity-based funding and talk more about performance, because I didn't want to risk today to say that the Performance Authority is here to assess the impact of activity-based funding. We're not. We're another arm of the intentions of health reform around bringing greater transparency to the people of Australia about their healthcare system, public and private hospitals, and primary care communities and other health organizations. So let's go back and see what we've accomplished so far in making that contribution to the Australian landscape. In terms of the establishment of the authority, it has its origins in intergovernmental discussions about the future of reform in our nation. Most notably, the National Health Reform Agreement in 2011 really sets out the parameters and expectations from government leaders around the contribution and the unique contribution that would be made by the National Health Performance Authority. A subset of that, of course, is included in statutes. And I'll show you a slide in a minute. What it says exactly in statute will be the contribution of the authority in realizing the vision that is articulated in the agreement. Within the agreement, the scope of work within the statutes to meet the intention of the agreement around performance is then articulated in a performance and accountability framework, which we just released about a month ago. And so I have a number of slides to inform you about what the content of that document is, but it's available on the Performance Authority's website.